Legionnaires' disease has been around since the 70s, but a lot has changed with Legionnaires' disease, so there are a lot of misconceptions about it. So what is Legionnaires' disease, first of all? Legionnaires is a kind of pneumonia. It's a bacteria that causes pneumonia, and it's really no different than any other kind of pneumonia. It's just that that's the name that's given to this bacteria. Next slide. And so why is it called Legionnaires' disease? Some of you may remember the original Legionnaires' disease outbreak in 1976 at the Bellevue Stratford Hotel. What was really different about Legionnaires' disease in those days is that it had never been identified before. So when people became sick, nobody knew what was causing the Legionella. And in addition, in those days, there were not as many antibiotics as there are now. So the antibiotics that were generally used to treat pneumonia didn't work. And many of the Legionnaires in that original outbreak, there was a convention of Legionnaires in the hotel, and that's how the bacteria got its name. Many of the Legionnaires in that original outbreak did die because they did not have the appropriate antibiotics. This is very different now. There are many more antibiotics. The antibiotics that we give people when they have pneumonia, or even when they don't, when they just have respiratory symptoms, will treat Legionnaires' disease. So as I said, there's no way to tell Legionnaires' disease from any other kind of pneumonia. The symptoms are the same. You get fever, chills, cough, muscle aches, headache, tiredness, loss of appetite. Legionnaires' disease, there might be a little more diarrhea than you see with other pneumonias, but it's basically the same. And then if you do a chest x-ray on the person who has Legionnaires' disease, you will see a pneumonia. And the time from when someone is exposed to the bacteria to the time when they get sick is usually between 2 and 10 days. So if you had the symptoms of Legionnaires' disease, with the symptoms of pneumonia, the most important thing would be to go to your doctor. Now, another thing that's very, very different about Legionnaires' disease now than it was at the time of the Bellevue Stratford outbreak is that there's a way to diagnose Legionnaires' disease, which there wasn't then because nobody had ever seen it before. And there's a very easy way, actually, which is there's a urine test. This is unusual among kinds of pneumonia, that you can just give urine in a cup and they can test it to see if you have Legionnaires' disease. So how do we, the health department, sort of learn about and follow Legionnaires' disease, which is, if you have the signs of pneumonia and you go to your doctor and your doctor tests you for Legionnaires' disease, the laboratory is required by law to report that to the health department. So all cases of Legionnaires' disease that are diagnosed in New York City residents are reported to us. If you go to another state to be diagnosed, occasionally people in New York City will go, outside, so other states aren't that far away, the other state will report it to us. When that happens, somebody from the health department will call either you, if you've been diagnosed with Legionnaires' disease, or if you aren't up to talking, your closest relative, and ask a lot of questions. And these questions will include things like where you live, where you spend the night other than where you live, where you go to the grocery store, where you go to the gym, if you go to church, those kinds of things to figure out everywhere that you've been. And the reason for this is that Legionnaires' disease, or the bacteria, it grows in the environment, it grows in water. And we see it everywhere in the environment, and that's part of what's complicated about Legionnaires' disease. When someone gets it, it's not really clear where they got it. The way people get Legionnaires' disease from the water is that the water becomes aerosolized, and you breathe it in. So we will call up and we will ask all of these questions in order to try to understand where it might have come from. Then we take all of these cases and we map them. So we always know where there are cases of Legionnaires' disease in the city. In addition to that, in the last year, we've added an extra analysis that will alert us immediately if people live in the same building or complex, like Co-op City, for example. And that has to do with just the improvement in our technology It allows us, every time the case is entered into our computer, to do something called geocoding, and then we have data from the city about buildings and complexes. So we can immediately figure out if the cases are clustered in the same building or complex. So as I said, Legionella is found in the water. It's found in fresh water worldwide. And people get it when they breathe in mists of water. Most cases are traced to environments in which the water is somewhere between 77 and 108 degrees. It likes warm water. But the important thing actually is that we find it in a lot of places. And we don't know why people get Legionella from certain exposures and not from others. And also not everybody will get Legionella. People who have underlying respiratory problems are more likely to get Legionella, people who are elderly. But we don't entirely know why some people get it and some people don't. It is not, that's not. The Legionella bacteria likes to live in the biofilms of pipes. And that's what provides shelter and nutrients for the bacteria. You can see a pipe there in that picture. I know it's not a pretty sight, but pretty much all pipes actually have such biofilm. So that's where the Legionella like to live and grow. Next slide. So where can Legionella come from, or where has it been traced to? So it can come, you can find it in hot water tanks and pipes, especially if they're not very hot. If they're very, very hot, it will kill them, but if they're warm. In aerators, when water is aerosolized, so theoretically from showers and faucets, unused piping. Sometimes if you have apartments that aren't in use for a long time, there'll be dead legs and more biofilm will grow because the water's not coming through a lot. You're less likely to see it if the water's being used a lot in an apartment. Next slide. The most commonly thought of site actually is cooling towers. Cooling towers are these big systems on the tops of buildings that, for commercial buildings, that evaporate water, and that can put mist in the air, and then you can just sort of get it when you're outside from breathing in the mists. It is not found in wall air conditioner units. I think because of the cooling towers, people get confused and they think that you can get it from wall units. It's actually never been associated with the window air conditioner. Next slide. So as I said, it gets in the air, even outside, and then you can breathe it in. There is a theory that you also might be able to get it if you aspirate, which is essentially if you choke on water, but not really so much when you just drink the water because it's not going into your lungs. It really has to get into your lungs. So again, we don't know why people get Legionella, sometimes not others, but you need to have the conditions that you need. You need to have it growing in the water, then you need to have a way for it to get into the air, and then, some strains are more likely to make people ill than others. There are many, many strains. Some patients are at higher risk. And then it's most common in the summer and the early fall. Possibly because that's when people are using these big cooling towers, or possibly something having to do with the weather and the bacteria in the air. As I mentioned, there are risk factors. A lot of them have to do with underlying lung disease. People who have underlying lung disease are at greater risk for Legionella and other types of pneumonia. Also people who have immunosuppression, people who are on steroids, have had transplants, people who are on hemodialysis, and people who have a history of alcoholism also do appear to be at higher risk. So then, as I mentioned, Legionella is now very, very treatable with antibiotics that many of you probably have in your medicine cabinet from the last time that you didn't finish your antibiotics. And you probably know the names of them: erythromycin, azithromycin. Sometimes your doctor will give you a Z-Pak. Ciprofloxacin. So this means that, if you are diagnosed, you can get the antibiotics and you can be treated. And that's what's really, really different now than the outbreak that we all remember watching in the news many years ago. Next slide. So one thing that we wanted to just emphasize to everyone is that all cases are diagnosed, and we will hear about them, and we will once, but ended up twice in my talk, I'm sorry. So this slide is actually showing the data. We track all of the cases. One thing you can see is that the number of cases has been going up. And it's not totally clear why that is. One reason we think it might be is that there's better diagnosis of Legionella. The urine antigen test came out in the 80s, but it did take a long time before a lot of doctors knew about it and used it a lot and thought about it. I think because it was so hard to diagnose in the old days, many doctors didn't think about it. So that is one reason that it has probably been going up. There may be other reasons that we don't know, but we definitely think that that's true, that there's better use of that test. The other thing that this slide shows you is that there's a seasonality to it, that you see more cases in the summer and early fall, and you really don't see as many cases in the winter. Next slide. So then just talking a little bit about what occurred here at Co-op City, since I know that's why you're here. As I mentioned, last fall we started this new program that allows us to really quickly see if there's more than one case in a complex. And we did detect that there had been 2 cases. They were a little over a year apart in this complex. It's relatively far apart, but because we noticed it, we called the management of Co-op City, which is what we do in this setting. And we said, we don't know that it means anything, but we would like to talk to you about your water system, since that's where it would come from. And we have a standard form that we ask buildings to fill out in this setting, and we sent it to them, and they did fill it out. And we reviewed it with them. And the maintenance of the hot water system here is very good. And having reviewed that, we felt, and there was that fact, and there was also the fact that by the time we put this new system in place and detected it, there really hadn't been any more cases, and we had pretty much made it through Legionella season. So the combination of the fact that the water system really did appear to be very well maintained here, and that we hadn't seen additional cases, did reassure us that things were okay. And we haven't seen any additional cases, but you should know that we always watch for Legionella. That if anybody is diagnosed who lives in Co-op City, we will know about it, and we will immediately call up and interview. So we are going to be continuing to watch the system carefully. We always do that, not just here, but everywhere in the city. So we wanted to just reassure you about that. And then also just to answer some questions for you about what you should do if you're worried. And really the number one thing you should do is if you have symptoms of pneumonia, you should see your doctor, and you should say, I'm nervous about Legionella, could you test me for Legionella? Because if you have pneumonia, you should be tested for Legionella regardless of what's going on in the building. And also, it's a pretty easy test. You don't even have to have your blood drawn for it. So we really recommend that you do that. And then if you do have symptoms of pneumonia and your doctor gives you antibiotics, it's always important to take those antibiotics and to complete them. And after you leave your doctor, usually they say, if you don't feel better in 2 or 3 days, call us. It's also important to do that. If you don't feel better in 2 or 3 days, you should call the doctor back. But I imagine that you have other questions about Legionella, so